This episode of Doc Talk is brought to you by the Kappa Boot Scootin' Ball, featuring the president of the Redneck Yacht Club himself, Craig Morgan. Join us Friday, April 5th for the Knoxville's most talked about fundraiser of the year. The event will be packed with great country music provided by Craig Morgan, line dancing, Western-themed dinner, bottomless beverage, and an exclusive Kappa Boot Scootin' Ball souvenir mug. Additionally, a silent auction valued at more than $40,000. You have the opportunity for those in attendance to bid on some packages, including a Dynasty Spa. For tickets, visit kappabootscootin.com.
Hi, welcome to another broadcast episode of Doc Talk. Doc Talk, if you remember, is the podcast that is put out by the Knoxville Academy of Medicine, where we talk about health issues in plain language for the community here so we can understand and improve our health as we move forward. Today I am so excited that we have joining us Dr. Jose Mejia, who is a general surgeon associated with Premier Surgical Associates. And we are going to talk about colon cancer. Is that correct?
That's correct.
Welcome, Jose. How are you?
Fine, thank you. Thank you very much for having me today.
So glad you could join us. Okay, so what's a colon?
Well, the colon is, in essence, is what is between your stomach and the lower part of your piping system in the abdomen. The colon is a structure that helps to absorb mostly water, fluid from your intestine into your system. Okay. It has also other properties, like has something to do with the immune system in your body, but it's what helps you to absorb mostly liquids, fluids from your intestine into your body.
Okay, so not to get too graphic, but that colon is like this long sausage in our body that produces fecal matter, BM, right?
That's correct.
Okay. All right. So cancer, you can get cancer in that part of the body. Is that right?
You can get cancer in the colon as many other parts in your body, but in the colon is the third most common place in your body. The third most common place in your body that you can develop cancer in male patients after lung and prostate cancer, and in female patients after breast and lung cancer. So it's the third most common part of your body that you can develop cancer.
Oh my gosh. Okay, so it's the third most common in females following breast and lung?
That's correct.
And in men, it's just like right up there with prostate.
After prostate and lung cancer is the third most common place you can develop cancer.
It's preventable, or
most of the
maybe?
Times, most of the times it's preventable, provided you take the measures for that to happen.
Okay, so I like to stay healthy pretty much, eat well, exercise, all that stuff. But so what are we supposed to do to early detect colon cancer?
The key for detection in colon cancer is, I always tell my patients, have a good PCP, a good primary care doctor. He or she is the one that will assess the need for you to have a test related with colon cancer.
Okay.
That's the main key of prevention. Have a good primary care doctor who can assess you what is your risk for developing colon cancer.
I couldn't agree with you more. And with the development, so many of our younger individuals now who feel like they don't have time to establish a relationship with a primary care provider. They just figure if they get sick, then they go to one of the walk-in clinics and get their medication. But that doesn't really help to prevent colon cancer, does it?
No, it does not. If that's something good about being young, is really colon cancer doesn't happen in average in young people. Colon cancer happens most of the time in people above the age of 50 years old.
Okay. So do we have to get a screening after 50?
That's the recommendation. Once you reach the age of 50, provided you come from, you don't have any type of family history of colon cancer, age of 50 is your trigger time to have to be tested for colon cancer.
Okay. I'm way past 50. So when you turn 50, that's the trigger and says, what do I have to do?
A colonoscopy.
A colonoscopy.
Colonoscopy is the most recommended procedure to have done in order to assess what is if there's a problem in your colon.
Okay.
That involves the introduction of a TV camera through your rectum and goes all the way along your colon, and that's the way we can pick up most of the times lesions that can be resected and avoid for those lesions to evolve into colon cancer.
Okay. If it turns out that you have colon cancer, what's the next step then? You know, you have a colonoscopy, and the doctor finds something suspicious, so he takes a sample of tissue, a biopsy. Excuse me. Then he says, "Oh, you have colon cancer," and then he would refer that person to see you, yes?
Most of the times they get referred to a surgeon because unfortunately that's one of the few things you cannot treat with medicine. You need to have a procedure, you need to have a surgery to have the colon cancer removed.
That's very important, yeah.
Having said that, there's sometimes patients can be lucky, we can say so, and when a polyp is detected in the colon, sometimes cancer can be on top of the polyp, and just resecting the polyp can get the patient rid out of the colon cancer.
Oh, that's terrific.
But it's not the norm. Most of the times patients have colon cancers that need surgery.
Okay. So when we find out that we have colon cancer, then treatment could be either surgery or medicine like chemotherapy or X-ray therapy, radiation, but colon is unique in that it requires most of the time surgery.
Most of the times it's a multidisciplinary approach when you have colon cancer, but 99% of the times, I mean, in order to treat colon cancer, the first step is surgery.
Okay.
Depending on the staging of the colon cancer, how bad is the colon cancer, if it has invaded the lymph nodes, you may need to have a chemotherapy.
So when the doctor says we need to stage your cancer, what does that mean?
When we stage a cancer, you need to do some extra tests. For example, we do a tomography, a CAT scan of the abdomen to see if this cancer has spread outside the colon. For example, it's well known that the cancer in the colon can spread into the liver.
Oh, okay.
So that's a way to stage. You do also it depends on who you go and see, but sometimes you can have a PET scan if you think the cancer has spread outside your abdomen into the chest or even into your brain. But most of the times the colon cancer, when it's at the beginning, when it starts spreading, goes to your liver.
Okay.
So that's the way you do a staging. You do a CAT scan of your abdomen. Of course, you also check chest X-ray to be sure that you don't have any nodules in your lungs.
Okay.
But that's the staging. It's just staging means looking for other places where the colon cancer could be.
Okay. And then when we stage, we get a better idea of what's the best multidisciplinary approach for it, right?
That's correct.
Okay. So what if we decide after we stage that surgery, what would that be like?
Well, colon cancer surgery is a very, very tough operation.
Okay.
Until 10, 15 years ago, the only way to really resect the colon cancer from the abdomen was done making a big incision in the abdomen.
Okay.
But in the late 80s, 90s, the laparoscopic techniques came came available, and so that involves making small incisions in your abdomen, and sometimes we can do surgery with the small incisions with laparoscope, putting a TV camera inside your abdomen.
TV camera.
Another technique we've been using for quite some time is not too old. It's quite new. Is we're doing robotic surgery. Involves the same approach, putting a TV camera in your abdomen, but the robot is a machine that allows you to have a more precise operation.
Wow, wow. That's so great, because then you don't have to be incision from top to bottom, right?
That's correct.
So am I right to assume then that you heal faster?
The healing is faster if the incision is smaller, and sometimes even the pain is better. I mean, you don't have so much pain because there is small incisions. People can go back to work faster than other people. It depends. I mean, not everybody fits in the same bill, but smaller incisions mean faster healing and recovery.
Okay, so I'm going to, I always hear people say, my neighbor says, oh, Joe was doing great until they opened him up to operate on his cancer, and then it spread like wildfire. Have you ever heard patients say that?
It's not rare to see that, but those are situations that the cancer was already spread in the abdomen. Of course, sometimes patients have just mild symptoms like some bloating or pain, and the cancer gets discovered. You go there and take a look, and unfortunately, that's already spread. Oh. That's what he meant. But no, because you do the operation, the cancer will spread. You don't trigger the spread of the cancer. Much likely, the cancer was already there, spread inside the abdomen.
So it's so important to get a really good idea of what your stage is and be prepared for what you might find before you put the camera inside of your stomach.
That's correct. Most of the times we try to stage, like I mentioned, with an X-ray, with a CAT scan, but the real final staging is once you do the surgery, because you can, there's something something besides the colon called the lymph nodes.
Yes.
And if there's cancer in the lymph nodes, I mean, your staging goes up. And when you see cancer in the lymph nodes, you know that in addition of the surgery, you're probably going to need to have chemotherapy.
So it is really important for a surgeon to get in there and really take a good look around, because sometimes surgeon eye is equal or maybe a little better than CAT scan in finding the cancer.
Absolutely.
Yeah.
The CAT scan is useful, but if we know we're dealing with a colon cancer, I mean, you won't know more until you are there and you have an idea how big is the cancer, or where has it spread.
It's just a tool. Yeah, I understand. Okay, so Joe has colon cancer, my friend Joe, and he had surgery, and then he came out and he had a bag on his stomach, on the front of his abdomen, and what was that?
Sometimes when you go there and try to do surgery, you find surprises. You find that the cancer is extremely big,
right,
or has spread outside the area of the colon,
right.
So there's sometimes the key when we do colon surgeries, we try to cut above and below the cancer and hook the tips of the pipe together.
Yeah.
Unfortunately, sometimes the patient can be very malnourished, or they have other type of medical issues that you can see that your hookup of the piping is not going to work.
Okay.
So there's when we have to do what's called a colostomy.
Okay.
We hook up the colon to the skin with the bag for a while. That can be temporary or permanent. It all depends.
Okay.
Sometimes we do what's called a temporary colostomy. We give the patient the option to get better nourishment for 2 to 3 months. Once his medical condition improves, we can put things back together.
Okay.
So that's sometimes a game. You go down there and sometimes it's a judgment call. I mean, the last thing you want to do is put the pipe back together and then the pipe breaks apart in 2 or 3 days.
That's not good.
No, this is a bad situation. Can that happen? Yes. There's no a clear way to predict or not, but as time goes by, we as surgeons, we have learned to more or less to have an idea who is going to have a good result being hooked back together or not.
Okay. So if a person comes to you with colon cancer and they're anticipating surgery, what advice do you give them before they have this surgery?
Well, the first advice I tell my patients, I have had over the years very young patients, very old patients, but the first advice I told them, let me worry about that, because they already are extremely stressed with the diagnosis. So I always, the first advice I tell them, just let me take care of the cancer. We'll see what we need to do. We'll do the operation, and after that we'll take the next step. It's very important to have the patient emotionally prepared for the operation. Patients that get into depression or they try to neglect the care, I mean, they do bad. It's the relation between the physician and the patient is extremely important. Not because you've met them for the first time means that you are going to be too blunt with them. We need to establish a good relation with the patient. And again, that's my best advice to the patient. Just let me. First of all, of course, I need you to comply with all the requirements. I need to do a CAT scan. We need to do lab work. But let me worry about this thing, and then after that, we'll take the next step.
Okay, so if you have colon cancer, you think you have colon cancer, you need to call Dr. Mejia and just let him shoulder your burden and take care of that, and you're in good hands. If they have more questions about this, how do people reach you if they have questions?
Well, they're welcome to contact us as Premier Surgical Associates in North Knoxville Medical Center. Our main office is there, so we're a group of 5 surgeons there, including myself. We'll be more than happy to help or assist in whichever questions they have.
What happens when you are diagnosed with colon cancer? It is not the end of the world. It is certainly a journey that you take together with Dr. Mejia and fight this disease. So that's a wrap.
This episode of Doc Talk is brought to you by the Kappa Boot Scootin' Ball, featuring the president of the Redneck Yacht Club himself, Craig Morgan. Join us Friday, April 5th for the Knoxville's most talked about fundraiser of the year. The event will be packed with great country music provided by Craig Morgan, line dancing, Western-themed dinner, bottomless beverage, and an exclusive Kappa Boot Scootin' Ball souvenir mug. Additionally, a silent auction valued at more than $40,000. Give the opportunity for those in attendance to bid on some packages, including a Dynasty Spa. For tickets, visit KappaBootScootin.com.